It's certainly a great privilege to introduce Dr. Jackie Yim, who is a radiation therapist and holds a PhD in health economics titled The Economic Implications of Anxiety and Depression in Cancer Care. Alex is passionate about research that seeks to improve our patient outcomes and brings to his team the expertise in project management and analysis of large data banks. He's worked extensively across public and private radiotherapy settings and has also led the development and implementation of new clinical practices. He joined the Brain Cancer Group clinical research team as our project manager in March of last year, and it's a great privilege that he will come and speak about our data bank now. So, ladies and gentlemen, Dr. Jackie Yim.
Yep, great. So good evening. My name's Jackie, and I'm going to be talking about the Brain Cancer Group Databank project. So just to give you a quick background, the Brain Cancer Group is committed to 3 pillars, which is research, education, and support. And the Brain Cancer Group Databank project cements our commitment to the research pillar. The Databank project comprises of 3 TBCG-funded components. The first one is the Brain Tumour Biobank and Laboratory. The second one is the Clinical Outcomes Database. And the third one is an imaging laboratory. So the Brain Tumour Biobank and Laboratory is already an established unit, and it's based at the Colling Institute of Medical Research on the Royal North Shore Hospital campus. And its main function is to bank and study brain tumour specimens. The second component is the Clinical Outcomes Database, and that's a detailed database that gathers baseline tumour and treatment information from our patients and assesses treatment outcomes. And the development of this database could not have happened without the generous donations received. The information from the biobank and the imaging laboratory will feed into this database. And then we have the Brain Cancer Imaging Laboratory, which gathers patient images for future study and assessment. And we already have a couple of research projects running out of this, so that's really exciting. And it's the only imaging laboratory in Australia, and is a great resource for local and international researchers. So you might be thinking, why do we need to establish a databank? Well, essentially the databank will serve as a centralized repository for all patient treatment information. So that includes surgery details, medical oncology, radiation oncology, pathology and biobank, and even imaging details. And the advantage of having a centralized repository is that there's no need to look up different information systems about a patient's treatment journey, which means less admin work for clinicians and that they could dedicate more time for patient care. It also means that there's a complete picture in one spot, and that allows for an even more holistic approach to patient care. It also means that it streamlines the research process because there's no longer a need to trawl through different databases or different sources to gather that research study sample that you need. So what it means is quicker research means quicker translation of research results and ultimately benefiting patients and families. So before I talk about the database itself, let's just take a step back and look at the patient journey. So most people diagnosed with a brain cancer will go through a couple of, can I get the laser? Great. Often we'll have surgery, we'll have some imaging, and then have some radiation therapy or chemotherapy or both. And then people then often will have lots of follow-up appointments. And then after that, we sort of enter into the survivorship sort of area where some people may go back to work and some people may need access to psychosocial support services or even rehabilitation services. And we see that every interaction is an opportunity to capture data that could improve patient and carer outcomes. So with surgical details, so if we look at this from a data point of view, for surgical details, often that's stored in a system called POW chart. With medical oncology information, that's often stored in a system called Mosaic. Radiation oncology details are often stored in a system called ARIA. Pathology and biobank have their own systems, and the same with imaging. So you can see that the information is stored across different systems, but the main issue is that they don't talk to one another. And so what the TBCG Databank does is it brings together multiple sources of data for clinicians and researchers. And so for clinicians, it means there's less time spent on admin tasks and they have more time for patient care. And for researchers, of course, with ethics approval, can now access a rich data set that has information about all the treatments and diagnostics a patient has had. And a comprehensive data set like this is quite rare and has great potential for new discoveries to be made. So now I'm going to talk a little bit about the Databank platform and how we're housing all that information. So we're using this system called REDCap, and REDCap is a widely used research data collection system. It's a web-based platform, and so it can be accessed anywhere as long as you've got internet. It's free to use under the Northern Sydney Local Health District's facilities. It's got unlimited data storage, which is great for us. And we also have a dedicated REDCap administrator on site, which has been incredibly helpful on many occasions. So the advantage of using REDCap is that there is already an international community that's using it. And just grab the stats off their website there. There's over 6,000 institutions using this across 147 countries. There's 2.2 million users. So it's very widely used. And new functions are constantly being developed and improved. And we can leverage off those improvements. The other advantage of using REDCap is that we can easily collaborate with other sites who's also using REDCap. And we've already started that with the RPA Lifehouse group. And coming soon is Western Sydney Local Health District. There's also a data collection app that's available for us to use. We haven't started using that yet, but that's coming. In terms of data security and confidentiality, the data is hosted on the Secure New South Wales Health Northern Sydney Local Health District servers. And if you see on your right, I've just done a quick screenshot of some of the options that we can be setting up in the background to maintain patient confidentiality. So most of it is maintained through setting up user rights. So that could be that's customizable based on the individual level or based on the group level. So we can put a bunch of users in a group, or we can edit their rights individually. We can also restrict viewing and exporting of all data, and patient identifiers can also be anonymized based on viewing rights. For added security, all user accounts expire within a year and have to be reapplied if access is needed. So I'm just going to show you a couple of screenshots of what the Databank looks like. So this is the search dashboard. So essentially it's like a Google search. So here we've got sort of like a search criteria. So at the time of taking this screenshot, we've got last name. So if we're looking for John Citizen, we just type in Citizen here and then we press search. And then all the patients who have the last name Citizen should sort of populate in this table down here. So if John Citizen was the first patient, we'll just click on his record. And then that will bring us to the patient record page. And this is the page where you can see what information has already been filled out. What's really useful on this page is that we've developed a summary section at the bottom where you can easily see whether a patient has multiple instances of surgery, pathology, systemic therapy, or radiation therapy. We've also developed a timeline function, which is also incredibly helpful for your doctor or for a clinician to have a look at what you have received or what a patient has received. And so for this example, they had surgery and then had some chemotherapy and then progressed and had some more surgery and so on and so forth. But this function is incredibly useful as it displays all information in a chronological order. So in summary, the Databank project brings together information from various medical record systems. It helps clinicians to see at a glance what a patient has received. It also enables and strengthens research collaborations. Patients and families are at the heart of the Databank project because seamless data collection from disparate sources enables timely conduct of research and can lead to findings that will improve outcomes for patients and their families. So looking forward, the next steps for this project are to develop automation for data collection. We also want to develop a pathway for routine data collection so that data is collected alongside clinical practice. And we also want to be able to develop an intuitive front page for the data stored in REDCap. And before I finish, I would like to say a big thank you to all donors and supporters for supporting our brain cancer research program. The establishment of the different components within the Databank would not have been possible without your generous support. So thank you.